Hi, my name's Kayla. I'm going to be performing colostomy care skills video today. So first, I would start by entering the patient's room, introducing myself. Hi, my name is Kayla. I'm going to be your nurse today. I'm going to be doing colostomy care. So I'm going to go ahead and provide some privacy, close the doors and any curtains. Next, I would perform hand hygiene. And I would ask the patient to identify with their name and date of birth, so I would check their wristband. Next, I would go ahead and place a towel on the area where I'm going to provide colostomy care. I'm going to go ahead and apply clean gloves. And I would make sure they fit properly. Make sure the patient is in a nice, comfortable, reclining position. And I'm going to go ahead and get started. So we're going to go ahead and remove the adhesive ring that you have on now. Now I would make sure I do this gently, not to do too much pulling and tugging at the skin. Once I take it off, I'm going to put a towel over the stoma. And I would go ahead and take this to the bathroom. I would empty and measure the output. So for the purpose of this video, I'm going to go ahead and save the ring. So that would go in the trash. Put that there. So I would return, empty my gloves, perform hand hygiene. I would put on a new pair of gloves. I don't have any, so I would make sure I'd have a clean pair of gloves. I'm going to remove the towel here, put that in soiled waste. And I'm going to go ahead and clean and dry the area before we apply the new adhesive ring. So I have 2 towels here. I'm going to make sure I have warm water and the approved solution already handy. And just open this up. I would clean around it. Use another part of the towel. Clean the top of it, nice and gentle. So I would discard that and soiled. And I would use another towel to go ahead and pat dry. So I'd go around, maybe on top, and discard that. Next, I'm going to go ahead and assess the stoma, make sure it's pink. There's no skin breakdown, no abnormal drainage. And we're gonna go ahead and measure. So I have this measuring guide here, and I would use it to eyeball and measure. And I've already pre-cut this to make sure that there's 1/8 of an inch between the ring and the stoma. We don't want it to be too small. We don't want it to be too big. After we've measured, we'd go ahead and trace the size to cut the adhesive ring. And I've already done that, so we have that ready. Next, I would go ahead and apply protective skin prep. So we apply it around the stoma. I would make sure that is completely dried and go ahead and apply. So in real life scenario, we would take off this wrapping here so that it sticks. So I'm going to go ahead and apply it over the stoma. Make sure it's completely secure and sealed so there's no leakage and skin breakdown. Okay, next I'm going to make sure it's nice and secure here at the bottom. So we have this rolling up to do, and then we get both sides and bend them. Make sure there's gonna be no leakage from there. So now that it's nice and secure, I'm going to discard all of my materials. perform hand hygiene. And make sure my patient is in a comfortable position and document my procedure.